Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, February the 10th, 2021. We are in week 49 of the coronavirus pandemic here in Montgomery County. Today, I'm joined by my colleague, Commissioner Ken Lawrence. I'm going to start with an update on the UK variant of the coronavirus. There are now a total of four confirmed cases of the UK variant in Montgomery County. All four cases received investigation and contact tracing. They range in age from the mid-20s to the early 70s. None of the four cases had yet received a vaccination. They did not report major underlying medical issues. They all reported mild to moderate symptoms. None have required hospitalization. None of these cases reported domestic or international travel, attendance at community or mass events, exposure at a long-term care facility or a congregate care setting, no sports exposures or other known high-risk exposures. We have confirmed additional cases linked to some of these individuals. Therefore, there are additional confirmed COVID-19 cases that we consider probable for the variant strain. But this has not been confirmed by genomic sequencing the virus from these individuals. Genomic sequencing, which is a laboratory test that can confirm whether or not this is one of the variants, remains very limited. All of this signals to us that the variant is likely much more widespread within the community than can be confirmed through lab testing. According to the CDC, the variant spreads more easily and quickly than other variants, and this is another reminder that we must all continue to wear our masks, maintain social distancing, keep our hands clean and away from our face, and avoid social gatherings. Moving on to vaccine updates. We know that many people, seniors in particular, lack access to the internet or have trouble navigating our website. That's why I'm happy to announce our COVID-19 hotline is now live. The number to call is 833-875-3967. The Montgomery County COVID-19 hotline is operational 6 days a week, Monday through Saturday, from 8 a.m. to 8 p.m. Live operators will be able to answer your COVID-19 questions. In addition, the hotline has Spanish-speaking agents and language line support for over 100 different languages. We encourage people to call this number or email covid19@montcopa.org with general questions about COVID-19 and the vaccine. Please note, the hotline cannot provide updates or timelines on vaccine pre-registration or troubleshoot issues with vaccine appointments. It is only for general information. In the near future, people will be able to pre-register for the vaccine through this hotline, but that feature is not yet available. We expect it to be operational next week, so please stay tuned. Let me just reiterate that this hotline this week is not able to pre-register people for the vaccine. We do hope to have that available by next week. So for those of you who have already pre-registered on our website, we are working to communicate with you more regularly in order to give you information about where you are in the line of registrants. Starting this week, if you pre-registered for vaccine with Montgomery County, we will be sending you a weekly email to keep you updated on our vaccination progress and what you can expect when it's your turn. As of 9:30 this morning, we have 153,502 people pre-registered. At this time, and depending upon when you registered and depending upon how much vaccine we receive, it could easily take up to 12 weeks or longer before you hear back from us about actually scheduling an appointment. but we will have this weekly communication with you just to keep you up to date. We also now have much more information on our website to give those of you who have pre-registered some idea of where you are in the line. On our vaccine page, there's now a link next to a blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th when the pre-registration opened. If you know the date that you pre-registered, you can see how many people are ahead of you. The website also now displays a running total of how many doses of vaccine we have received and how many doses we have given. To get to the vaccine page, go to montgomery.org/COVID-19 and click on the vaccine information button at the top of the page. Now, as I shared last week, we do continue to have issues with people sharing vaccine appointment links. This is not ethical or moral, and it needs to stop. Given the scarcity of the vaccine, we need to pull together as a community and make sure that our most vulnerable get vaccinated first. In response to this ongoing problem, we are close to implementing a system that will send out an individualized, single-use link for appointment scheduling. We hope to have this system running when we send out the appointment links for next week. We are committed to delivering the vaccine in an efficient and equitable way. In terms of the vaccine, as you recall, the County Office of Public Health received only 1,000 first doses last week. As a consequence, we have used up all of our first doses as of the end of the day yesterday. Our first dose vaccine clinic at Norristown High School is closed for the rest of the week and hopefully will reopen on Monday. We expect to receive 3,900 first doses sometime tomorrow. The good news is that we have been receiving our second doses. We received 5,800 second doses this week and continue to have the appropriate number of second doses to administer to those who got their first dose from us at the Montgomery County Community College. I want to remind everyone that wherever you receive your first dose of vaccine, this is where you need to go to get your second dose. I do remain encouraged by the enthusiasm that so many people have to be vaccinated, and I continue to ask for your patience because, as you can tell from these numbers, we have not a lot of vaccine and an awful lot of people registered to get it. So here is our weekly graphic giving you an update of where we are in this process. So the number of first doses received is unchanged from our press briefing last Wednesday. We've received 22,500 doses. We have administered all but 61 of these doses. We continue to be able to easily give 1,000 doses a day, actually a little bit more. And we hope to get additional vaccine tomorrow, and we're planning on that, but we don't have it yet. You can see that we continue to have a very, very large number of individuals in the 1A category, approximately 250,000. But as a county, we are making some steady progress in terms of vaccinating people. We now have partially covered 59,217 individuals and fully covered, meaning they've received both doses, 16,710. We also have received a number of questions about other locations to get vaccinated in Montgomery County, like pharmacies. I just want to reiterate that the Montgomery County Office of Public Health does not distribute vaccine to pharmacies, nor do we have any control over how pharmacies use that vaccine. Thus, when you pre-register with the county, you are only pre-registering for vaccines given out by the Montgomery County Office of Public Health. You are not being registered with the pharmacies. The Pennsylvania Department of Health distributes vaccine directly to these independent and retail pharmacies. There is no centralized scheduling portal, so you must check with each pharmacy regarding their process to make an appointment. At this point, pretty much all of them have a website and some kind of instructions on how to get registered and to add your name to their lists. Also, some doctors' offices are starting to receive vaccine in the county. There's no problem with registering for vaccine at more than one location, and you can get a list of these other locations that is updated by the Pennsylvania Department of Health on our COVID website. We have a link to that state map at www.montcopa.org/COVID-19. And as a reminder, if you would like to be vaccinated and have not yet pre-registered with the county, anyone who is 65 years of age and older, and those who are between the ages of 18 and 64 with specific underlying medical conditions are encouraged to pre-register to receive the vaccine from the Montgomery County Office of Public Health. And again, you can do that at montcopa.org/COVID-19. Click on the vaccine information button at the top, and you can go straight to the county page and pre-register. So moving on to our regular update, since the February 3rd press briefing, we have 1,220 new cases of COVID-19 reported in Montgomery County for the dates inclusive of Wednesday, February the 3rd through Tuesday, February the 9th. This is a daily average of 174 cases and brings us to a total of 44,435. These positive cases are a result of a positive test for the virus, not from the antibody test. 55 of these are from long-term care facilities. 5 of these are from the Montgomery County Correctional Facility. 12 are from other congregate settings, and 1,148 are from our community. This week, these positive individuals are from are from 60 of our municipalities. All 62 of our municipalities are home to individuals with COVID-19. Today's individuals range in age from 2 months old to 100 years old. And as always, you can check our county maps at montcopa.org/COVID-19 for updated geographic information. Today, we had 601 females, 612 males, and 7 unknown. I am sorry to confirm that 19 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,166 deaths confirmed positive from COVID-19. These 19 individuals ranged in age from 67 to 94 years old. 16 died at a hospital, 3 at a long-term care facility. Overall, we've had 597 females and 569 males succumb to COVID-19. In total, the age range is from 25 years old to 106 years old. As you know, we try our best to report the racial breakdown of individuals that have died from COVID-19 where we have the information. At this point, we have 2 American Indian Alaska Native, 32 Asian, 6 Asian Indian, 5 Asian Korean, 137 African American or Black, 589 white, and 395 unknown. In terms of the Montgomery County Correctional Facility, the situation there is stable. We have had new commits that have tested positive for COVID-19 over the last couple of weeks. We have not had any issues with inmates in the general population. We are continuing to do routine antigen testing for all of our correctional officers. In terms of our positivity rate, we are seeing some continued good news there. Our positivity rate has continued that downward trend this week. Our 14-day average positivity rate is now 7.54%, as of Thursday, February the 4th. And that is compared with 7.93% as of Thursday, January the 28th. So this is great news. We continue to make steady progress here. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph shows the daily positivity rates from January the 8th to February the 4th. We are still above 5% on all 28 of those days, but you can see we are starting to get closer. We almost had one day we were down below that. So this just gives you another way of looking at this data and see that we are making some good progress here. Our hospitalizations continue to remain high, but also do continue to improve. Today, 239 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is decreased from 255 last week. 14.6% or 35 of these individuals are requiring a ventilator. Our hospitals do remain quite busy. And to put this in some context, and as you can see on this graph, on October 1st, there were only 24 patients hospitalized with COVID-19. So even though we are, coming down, we are a long way from where we were over the summer and into the fall. Moving on to testing, for the 14-day period ending February the 4th, 43,143 Montgomery County residents were tested. This is a decrease of 6,977 people tested compared with the 14-day period ending January the 28th. I really want to just continue to encourage people to be tested if they need or want to be tested. We have plenty of testing available. And I'll talk a little bit more about that in a minute. So moving on to our date tested graph. As a reminder, the gray bars in the background are the number of positive cases on the given day. The red line is the 7-day average of total cases, and that includes cases from the community, long-term care facilities, and other congregate settings. The pink is the 14-day average of those total cases. The dark blue is a 7-day average of community cases only, and the light blue is a 14-day average of community cases only. And then down at the bottom, those orange and yellow lines are the 7 and 14-day average of our long-term care facilities. So you can see we are doing a lot better. We are almost as low as our peak with it that we had in the spring. And, maybe by next week we'll be there. Zooming in on the last couple of months, you can see more clearly how we're doing. You can see that our 7-day averages in particular are really moving downward. So this is great news. I'm very much hoping that we don't see a Super Bowl spike. We are preparing the appropriate graphics in case we do see one, but we are very much hoping that we do not have to put that graphic up on this chart. But that remains to be seen, and we are slowly, steadily making our way downward, which is great news. So more about testing. We continue to have very good availability of testing, and I want to urge people to be tested. This is really one of the best tools in our toolbox to understand what's happening in our community, get a handle on any outbreaks that might be starting to bubble up. Our testing sites are open Monday through Friday with varying hours each day. This Saturday, February the 13th, the Willow Grove site will be open from 9 to 1. So that's Willow Grove on Saturday from 9 to 1. Registration for this site will open online at 7 p.m. Friday, February the 12th. And I do want to note that the testing sites will be closed on Monday for the President's Day holiday, just the testing sites. Assuming we have vaccine, our vaccination sites will be open. As a reminder to register for a test, you can do that online at moncopa.org/COVID-19. At the top of the page, click on the green County Testing Information button. Appointments open at 7 a.m. on the day of testing on the online portal, and you cannot book ahead. You can also register by phone. Phone registration is available for all sites by calling 610-970-2937. And that starts at 8:30 in the morning of the day that you would like to be tested. And again, you cannot book ahead. Just a reminder that this testing is no cost to anyone who lives, works, or goes to school in Montgomery County. And you can be tested for any reason, including just that you want to be tested. We will test people of any age, and there is no doctor's note or any kind of order required from any health provider. So very easy to get tested with us, and we encourage you to do so. Just want to make just a quick reminder that if you know that you've been exposed to COVID-19, you should self-quarantine. If you would like to be tested, you need to wait a minimum of 5 days from the time that you were exposed to the person that has coronavirus. If you get tested more quickly than 5 days, that test will not be reliable. If you test negative after a minimum of 5 days having passed since you were exposed, and you've not had any symptoms, and you've not had any ongoing exposure to someone with COVID-19, then your quarantine ends on the 8th day after your exposure. Couple of quick announcements today. This Friday, February the 12th, is Korean Lunar New Year. And to celebrate, the Korean Association of Greater Philadelphia partnered with the Montgomery County Immunization Coalition and the Montgomery County Office of Public Health to put together 200 Lunar New Year gift bags for Korean community seniors. With these bags have a number of items in them, but very importantly, they have COVID-19 vaccine educational flyers in Korean, and we're so excited about this wonderful partnership. I want to thank our team for their efforts, and I encourage any other community groups to reach out to help us in our vaccine education efforts. We're happy to partner with you to provide templates, flyers, or any other graphics as requested. And we'll work with you to make sure that the flyers are done in a way that's culturally sensitive and in a way that will resonate with any community that would like to receive them. So please don't hesitate to reach out if you'd like to partner on this work. Also, we continue to hold virtual town halls on the COVID-19 vaccine. During these events, we partner with local healthcare and community leaders to share the latest information on prevention, vaccines, and answer your questions and concerns. Next Tuesday, February the 16th at 7 p.m., we're hosting a town hall for the Latino community on the COVID-19 vaccine. We're very excited to partner with Aclamo and Telemundo 62 for this event. The event is free. It's open to anyone who would like to attend. The program will be delivered in both English and Spanish. And to register, visit our website at montcopa.org/town hall. That's montcopa.org/town hall. And with that, I will turn over to Commissioner Lawrence.
Thank you, Val. I'm going to make an appeal today for the Montco PA COVID-19 Response Fund. In just a few weeks, we'll be marking the 1-year anniversary since the first 2 COVID-19 cases were reported in Montgomery County. And during the past year, our safety net organizations have stepped up repeatedly to meet the needs of our neighbors who have been most negatively impacted by the COVID-19 pandemic. Back in March 2020, the Montgomery County Foundation established the COVID-19 Response Fund to help our local safety net and first responder organizations provide greater assistance to our residents suffering the negative impacts of the COVID-19 pandemic. These nonprofit organizations provide food, shelter, senior services, veteran services, and much more. And many have been doing this while suffering from their own financial strain, trying to meet the overwhelming demand for food and services while donations are down. And this is why the Montco PA COVID-19 Response Fund was established by the Montgomery County Foundation with the help of local philanthropic partners, the BLBB Charitable Foundation, Health Spark Foundation, Pottstown Area Health and Wellness Foundation, VNA Foundation of Greater North Penn, Amerisource Bergen Foundation, the Philanthropy Network of Greater Philadelphia, the Gennardi Family Foundation, the Bucksmont Collaborative, the Tri-County Community Network, the Interagency Council of Norristown, Montgomery County, and many, many more individuals and citizens. To date, the fund has raised $917,000 and has granted $857,000 to over 250 safety net and first responder organizations. Projects are prioritized based on the geography they serve, the capacity to meet the higher demand for services, and whether the project targets particularly vulnerable populations. Grantees have included food pantries, senior care programs, rent and utility payment programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, protective personal equipment purchases for nonprofits, continuing essential in-person services and emergency shelters. The generosity of our community has really been amazing during the past year, but the needs remain present and continue to grow. So if you are able, if you would consider a contribution to help build the fund to continue to support our nonprofit organizations, tax-deductible donations to the fund can be made on the county's COVID-19 data hub at www.montcopa.org/COVID-19. And you can go under the Helping Your Community tab. And if you're interested in seeing a full list of grantees from the fund so far, that can be found there as well. And we want to thank all of our local foundations, businesses, and private citizens who have contributed to the fund so far. And that concludes my announcement for today, Val.
Great. Thanks, Ken. All right. So our next virtual briefing will be on Wednesday, the 17th of February at 1:30 p.m. And with that, I'll be happy to take questions.
Our first reporter will be Deanna Durancy from NBC 10.
Hello, good afternoon. Curious, you say that the county is working on coming up with a more single-use link for people. What about some sort of centralized site that would then take them to the pharmacies and different providers in the county to be able to try and find an open appointment? Is that a possibility?
Don't think it would be a possibility for us, simply because we only have jurisdiction over ourselves. We don't have any knowledge or awareness of what's going to which pharmacies or which doctor's offices. That is coming straight from the Pennsylvania Department of Health. And it changes on a weekly basis. You know, some weeks one pharmacy gets vaccine and then the next week they might not get any. So it would be very difficult for us, because we don't have any knowledge or control over what's happening with the pharmacies or doctor's offices, to be that portal. From my perspective, that would be something that the Pennsylvania Department of Health would need to put together, since they have the jurisdiction over the doses that are going to all of those other places.
Any information coming to you about pharmacies kind of taking clinics on the road or going places to do vaccination clinics? I know that we had asked in other briefings about the partnerships that some pharmacies were forming with, say, schools or things like that. Are you still seeing any of that, or are they primarily offering those vaccinations inside the pharmacies?
You know, Deanna, I don't really know that I can answer that question. Again, as I said, we don't know who's getting how much vaccine on a week-to-week basis. I do occasionally, or the Office of Public Health occasionally hears from constituents about issues that they observed in the community, but it's nothing consistent, and it's certainly nothing that we have any knowledge of in terms of all the pharmacies in the county.
You had suggested that people get on as many sites as possible to kind of register to get an appointment wherever they can. The state is saying don't do that, just register in one place? What should people
Yeah,
do?
I've heard that the state has said that. Honestly, I'd really leave that up to individuals. There are many people out there who, for really good reasons, are extremely eager to be vaccinated. And given that there's no central registration system, they don't have any choice really but get on each particular location's list. So in the perfect world, that wouldn't be necessary, but this is a situation that we're in. And, I, for one, wouldn't fault anyone for putting their name on multiple lists.
If the state is going to disperse to multiple pharmacies and other places, then I don't know why they would discourage people from trying to get it wherever they can get it.
How would that work then if an individual has pre-registered on the county site and then they go and get it at a pharmacy or a community clinic or something like that? Do they then need to cancel? Does that create issues for you down the road of having an open slot? So how does that work if somebody is waiting for the county site but gets it someplace else?
Yeah. So the way that this works is that when we send out our vaccination links, the folks that send them out keep an eye on how many appointments have been filled. And if for some reason it looked like not all the appointments were filled, then they would send out some additional links. And this will be very effective once we have the links individualized. So, if we send out 100 links and only 85 people make an appointment, then we'll send out another 15 links. That's what we have available as 100 appointments. So it won't be a big issue. We have looked into whether or not we could remove people from lists. We're a little reluctant to do that in these early days because we would hate to accidentally remove the wrong person. A lot of people have very similar names. And so we're just going to leave the list as it is for now. And if people have already been vaccinated, ask them to just delete that email when they get it. And we'll just send the link to somebody else.
I fear I'm going to ask another question that you say you can't answer, but I'm getting this question a lot from people on social media and who are reaching out to me. So I'm going to go for it. Schools. I know it's February. It's not January. But what are we looking at possibly for the start of the fall school year? Do we think we're going to be in the same situation where many of the Montgomery County schools are doing hybrid and virtual, or do you think there's a possibility of getting kids back into classrooms?
Well, I sure hope that there will be a possibility of getting kids back into classrooms. That is, I think, everyone's number one desire. But I cannot at this early moment look into a crystal ball and tell you what that's going to be yet.
Okay, I defer to everybody else on here. Apparently, I've gone too long.
Next, we'll go to Maria Pulcinella from WHYY.
Hi there. Has Montgomery County received any news about its Johnson & Johnson stockpile, if that's been approved?
I'm so sorry. You were breaking up a little bit. Could you try that again?
Sure thing. I was wondering if Montgomery County has received any news about its Johnson & Johnson stockpile, if that's been approved.
We don't have any news on that yet. Johnson & Johnson submitted their application for emergency use authorization to the FDA last week. Typically, that process takes 4 to 6 weeks to run its course at the FDA. So I wouldn't expect that we'll be hearing anything until the beginning of March about the Johnson & Johnson vaccine.
Gotcha. And earlier you referred to the line jumping that has occurred as immoral and unethical. Can you expand on that?
Sure. So here in Montgomery County, we set up a process where people could pre-register to get in line as long as they were in the 1A category and met the criteria for 1A. And what has happened here is that we have sent a link to an individual offering an appointment to them. And we have had a number of cases where those individuals sent that link to somebody else, to a family member, to a friend. Sometimes they have posted it on social media. And because of this problem that we've discussed with the links not being unique, other individuals were able to use that same link to make an appointment. Sometimes, many times, these individuals are not in the 1A category. And certainly we weren't, if they were in the line, they weren't at that point in the line. Otherwise, they would have gotten their own link. So it's just, we're in a very difficult situation. The vaccine is extremely scarce compared to the demand for the vaccine. And we created a process that was as fair and equitable as we could make it, given that in this county, we believe we have about 250,000 people in the 1A category. And it's unfortunate that people felt that it was okay to share those links. But as I mentioned, we should very soon have a process in place where each appointment link is a single-use link. And so even if someone did forward it or post it on social media, that link would be useless to anyone else who tried to use it.
Got it. Thank you so much.
Mhm.
Next, we'll go to Jim Melward from KYW.
Hey, sorry, I couldn't find the mute button. The 117 variant, hearing medical experts saying there's a lot of nuance and in some cases some fear mongering with the 50% more transmissible, as it still follows, they say, the same general tendencies with masks and distancing are just as effective. And while it's so many places now, it really hasn't had a massive effect on case numbers. Do you agree with that?
Well, I think the data from the UK does strongly suggest that it is about 1.5 times more contagious than the original variant. And the modeling that I've seen for the United States suggests that it would be in March that we would really start to see this variant, see like widespread evidence of this variant taking hold. So I don't know that enough time has gone by that we would be seeing a really dramatic effect from it. And of course, the other variable here is, will it be possible to vaccinate enough people in these next few weeks that it would have an impact on that? You know, I sure hope so, but that will remain to be seen. I think the most important point, though, is that people should just be aware that a variant that I think most data supports is more contagious than the original variant is in our midst, and that people need to continue to be very, very careful with their mask wearing and their hand washing and their social distancing.
But it does follow. People are thinking that this is, you know, bulletproof or goes through bulletproof masks, and you know that can find its way through the air and can hang longer. But that's not it. It's basically it can get in your receptors better, not necessarily spread more as far as like hanging in the air or going through masks or traveling across a room.
Well, I don't know that we can answer all of those questions with certainty. What I have read about this virus is that it does seem to attach more tightly to the cell walls that it will then invade into. I've not seen any data about whether or not it can persist longer in the air or in some way can more easily pass through masks. But should it, you know, once it gets to a person, it does seem to have a better ability to infect that person. So it's very important to continue to wear masks and follow all those mitigation measures, because I don't think we have good answers to those other questions.
With the line jumping, there's been some confusion between what you've said and what the state said. The state Department of Health said that they do not recommend using this for individual registration, that it was designed for medical offices to sign people up. So I guess my question would be, why did it take so long to correct this? If it's been a known problem on your end, why are we just now getting to a single-use link?
Well, it's we're only about 4 weeks into this, I remind you. And in those early weeks, we were registering entirely medical offices. And so we had a little bit of problems in those first couple weeks, but it didn't become as big of a problem until we started to get into sending links to individuals, although we did have medical personnel that shared the links as well. So the problem has been one that has been growing and one that required a technological solution. And so our team has been working hard to find a solution that we could implement very, very quickly on top of the existing PrepMod system. And then we are researching entirely new systems that we may at some point convert over to. But it's very important to understand that the thing that PrepMod does very well is send all the data about all the people that have been vaccinated to the Pennsylvania State Immunization Information System. It's called PASYS. We are required to report the data on everyone that's been vaccinated with a COVID-19 vaccine within 24 hours. So given the volume of people that we're vaccinating here in our county health department, we would have to bring in an entire team of people to manually enter that data into the PASYS system if we didn't have a program that uploaded it automatically. And so that's what's kept us with PrepMod, is that we have to do this reporting. So we're doing two things. We're developing a system that will be very quick to implement, that will let us send out individualized links. And hopefully that's going to start for next Monday's appointments. And then separately, we're looking for a new system that would also integrate with PASYS, but be more user-friendly and deal with some of these ongoing issues that we've been struggling with.
And as far as centralizing registration, the governor's office and the Pennsylvania Department of Health say they won't centralize because they see the issue being a supply issue, and they don't see a centralized registration being a benefit to helping that supply. But we're hearing signups on duplicate lists are an issue for providers. Those providers, pharmacies, hospitals, whatever they are overwhelmed by requests. It sounds like you would be in favor of a centralized system. Would you, or have you been calling on the state to work toward that?
Well, they're correct that it would not solve the supply problem. I mean, everyone has to remember we have a fundamental imbalance here between supply and demand. In the early planning for vaccine distribution, the 1A group was very small. It was basically healthcare workers, paramedics, and EMTs. And then we would have moved to 1B, which was a balance between individuals 75 years of age and older and many frontline essential workers. So when the 1A group got expanded to be age 65 and up or under 65 with certain medical conditions, as we've talked about here in Montgomery County, that added 250,000 people to the 1A list. We have gotten no increase in vaccines since that happened. And in fact, we have gotten less vaccines since that happened, just due to the overall supply. So a centralized system is not going to fix that imbalance between supply and demand. I do think from our constituents' perspectives, it would be so much easier for them if they could register or go onto one site and see, quickly and easily all of the places that are in their area where they might be able to get vaccine. But it really has to be up to the state to do that because we don't have the knowledge or information to create such a site.
Well, and last question, wouldn't a centralized system help efficiency, therefore indirectly help supply issues? And wouldn't it also alleviate your issues with PrepMod and these multiple use links?
I don't think it would. It would not alleviate the problem with the ability for people to share links. I mean, people would still have to get a link to make an appointment, and so under this current situation, it could still be shared. And I don't think it does alleviate the supply and demand problem. Look, there's hardly any supply. That is the problem. And I don't see why it matters if people are on more than one list. We've had, I don't know how many, but we certainly had people who we've reached out to them with an appointment and they said, oh, don't need it. I already got a vaccine somewhere else. And we're like, fine. And we just go to the next person. We have 150,000 people in line. So I don't care if somebody's on our list and somebody else's list. If they don't need our vaccine, we'll just move on to the next person.
Does the 150,000 plus take into account line jumpers, or is that impossible to account for?
You mean people that were at the back of the line that got a vaccine already?
Or people who weren't in line and were able to register?
Well, our 150,000 people are people that are pre-registered. So anyone who's 65 and up or 65 and under with one of those conditions can pre-register. So those are people that are just waiting to get an appointment link.
Gotcha. Thanks, Todd.
Next, we'll go to Carl Hessler from the Pottstown Mercury.
Good afternoon, commissioners. Thanks for taking my questions. Just a little confused about the PrEP mod system. If you're implementing a new single-use system, are you getting out of the PrEP mod system altogether at that point?
Not
Or-
yet.
Okay.
We may eventually get out of the PrEP mod system altogether, but for the next period of time, we will still be using PrEP mod. But in order to get into PrEP mod, you will have to put in a single-use passcode that you will receive in an email from the county if we have room for you, if you're, we've gotten to you in the line. And then once you enter that, you will be able to make an appointment through PrEP mod. That code is a single-use code. So even if somebody does share it, that code will not work once it's been used.
Why couldn't the state fix that problem? Why is it left up to the county to, implement this single-use link? The state is aware of the problem, correct?
You'll have to ask the state. I can't answer for them.
But you're not aware of them working to correct that problem.
I honestly don't know. I'm not part of those phone calls. My staff is. So I know that we have expressed this problem to the state on a number of occasions. I am uncertain of what the exact response has been. So you would really need to check with them.
Okay. And one other question. A couple weeks ago, you put out the word for volunteers to help with the vaccination program. What response did you get? Do you have any numbers on how many people signed up? What was the response?
Yeah, the response has been incredible. And I just want to thank all of the people that have volunteered. When I got the last update on this, which was about a week ago, we had already had around 700 people volunteer. So it's just been amazing. So I just want to thank all the people that volunteered. And also for those that we haven't reached out to you yet to accept your wonderful offer of help, that's why, because we've got about 700 new volunteers just in the last few weeks. So we're grateful that people have volunteered, and we may get to you yet and take you up on that offer. But right now, I think we're in pretty good shape.
Okay, and they'll be used as the vaccine supply increases and you're able to perhaps open up more sites or increase hours at the vaccination sites that you would use those volunteers, correct?
That's correct. So once we have a bigger supply, we've already been scouting out locations for a third and fourth location, mass vaccination sites. We could also start to consider weekend hours. There's a lot of things that we could do to make this easier, more accessible, and more convenient for people in Montgomery County once we have more vaccine.
Okay, thanks for taking my questions.
You bet.
Our next reporter will be Tom McDonald from WHYY. Tom, you appear to be muted still. Okay, we will move on for now and see if Tom can get those issues resolved. We'll go to Jeff Cole from Fox 29.
Thanks very much. Dr. Arkush, I think the last time I was on this line with you, you indicated it'd take you a year to get through 1A. Do you still believe it's going to take you a year to get through 1A in this county?
Well, at the current rate that we're receiving vaccine, you can do the math. If we're getting 4,000 doses a week, it'll take more than that.
What does that say about the county's ability to really end this virus and the spread of it if it's still going to take that long?
Well, this isn't a county problem. This is a problem in the United States. There's not a jurisdiction in this country that I'm aware of that thinks they have enough vaccine. So I am encouraged that the Biden administration is taking several steps. They have invoked the Defense Production Act, which should enable vaccine production to increase. I hope that happens soon and quickly. And as we talked about earlier, there is another vaccine in the pipeline, the Johnson & Johnson vaccine. They have submitted their data to the FDA for emergency use authorization. If that vaccine gets approved, that would bring a third vaccine into the mix. That one's helpful because it's a single dose vaccine. So again, when I make a statement about how long this could theoretically take, it's with current rates of receiving vaccine. Certainly everyone is hoping that the supply will increase, the delivery to the county will increase. We will be ready. If they send us more vaccine, we will be ready to give it. So bring it on is all I have to say. I can't wait until we have more vaccine and we can open up more sites. We are so ready. So as soon as we have vaccine, we will give it.
Yeah, just a couple of quick ones more. So, but you ran out of first dose on Tuesday. So you stopped. So yesterday evening, I think you said. So you stopped doing, obviously you can't do any first doses. So you're just doing second doses. And then when are you going to pick up with first again? You're going to get 3,000 more today, you hope, or?
Well, sometime tomorrow, we're supposed to get 3,900 first doses. So we will open back up on Monday is the plan, assuming that vaccine comes.
Yeah. And last question I have for you. I mean, we've spent a lot of time throughout the region covering this thing, and we've been in New Jersey a lot. And Jersey set up these mega vaccine sites in the county, and they're sort of drawing folks in. What do you think of that idea?
Well, that's basically what we've done here. I mean, we have 2 sites now giving 1,000 doses a day. One is giving 1,000 second doses a day, and the other is giving 1,000 first doses a day. Our problem is not giving the vaccine. We have no vaccine to give. I can open up another site or 2 in a matter of probably 10 days if we have the vaccine. We don't have enough vaccine to give.
Thanks a lot. I appreciate your time. Thanks, everybody.
Next, we'll go to Manny Smith from CBS 3. Manny, looks like you're still muted if you're trying to speak right now.
All right, there we go. Finally found that button.
Got it.
Thank you. Hey, Dr. Arkush, I don't know if you got a chance to talk about it earlier, but the CDC adjusted its requirement or recommendation, I should say, to say most people should look to wear double masks. I wanted to know if you concur and any additional reaction to that.
I'd heard that. I have not had a chance to actually read that guidance myself. So I'm always reluctant to comment on things that I haven't read myself. But I would imagine that is in response to the growing presence of this more contagious variant in our country, and certainly here in Montgomery County. It's certainly advice that is not going to be in any way harmful and could be helpful.
All right, and then secondly, we got a viewer email today kind of talking about the Norton Square Nursing Home in Norristown, PA. They're saying, hey, there've been some multiple deaths, and of 85 patients there, 55 people have tested positive for COVID-19 within a week's time frame, despite some vaccine being given out there. Are you aware of this facility and any concerns there?
I don't have any of those details. We'd be happy to follow up with you if you want to get with Kelly, and we can get you the information that we have on that.
All right, thank you so much.
Sure, no problem.
That concludes our first round of questions. If any of the reporters on the line have any follow-ups, we do have a few minutes to take any of those. So please indicate your interest in any follow-up questions by letting us know in the chat or by raising your hand. We'll go to Manny Smith from CBS3.
Hey, Dr. Arkush, and I know, listen, I don't know if you've gotten a chance to watch any of Bruce Castor's performance in Washington, and if you had any reaction to that. There's some reporting now to say that he had hoped to parlay a good performance into a gubernatorial bid and an endorsement from the former president. Any reaction to that?
I have no idea about any of his political leanings for the future. I did not get to watch the hearings yesterday in real time or today. I've been pretty focused on COVID almost entirely. I did watch a little bit last night, and I just think that this insurrection has been a really, really troubling moment for this country. And I would certainly urge all of the U.S. senators that have the incredibly important responsibility of voting on the president's culpability in promoting this insurrection, take that responsibility very, very seriously. And I hope that they put our country and our democracy ahead of any politics.
All right, so thank you very much. I don't know if Commissioner Lawrence wanted to get in on that.
I actually did see the opening argument yesterday. I was confused by them. Congresswoman Dean is on now, and she is representing Montgomery County and our Constitution fabulously.
All right, thank you so much.
Next, we'll go to Jim Melwart from KYW.
Wanted to go back to the current quarantine recommendations in Montgomery County. I'm not sure where. Are you still at 14-day? Did you adjust down, and is there any plans to reevaluate or look at those, especially mainly as related to schools, I guess?
I'm sorry, you said the quarantine guidance?
Yeah, quarantine guidance.
Yeah. So we've been following the general CDC guidance, which is that if somebody is able to be tested between 5 and 7 days after exposure to someone with the coronavirus, and they test negative and they've had no symptoms and they've had no ongoing exposures, then their quarantine can end after that 8th day. So depending on whether or not they choose to be tested, if they choose not to be tested, then the quarantine has to be a minimum of 10 days, as long as, again, there's no symptoms and no ongoing exposures.
And really quick, how often do you test for the variant in Montgomery County? Is that a regular thing, or is it kind of just a sampling?
So we're not actually the ones doing that testing. It's the Pennsylvania Department of Health that is doing that testing. And I know that they request a certain number of samples from the county, but I don't actually have the facts of that at hand here. So we can give you the details of that, but the testing is done by PADOH. We don't have that capability here in the department. And there is some process for that. I'm just not entirely familiar with it.
And with that in mind,
get that for you.
Yeah, and with that in mind, does that mean that these are samples that are going through Department of Health, or these are samples that Montgomery County collects, and then part of that sample goes to Department of Health? And if you don't have it, that's fine. We can talk about it later.
I don't have that. Not exactly sure what that process is.
Okay, thanks.
Yep.
We haven't received any further indications from any reporters, so that concludes our questions for today.
Thanks, everybody, and we'll see you next week.